We're going to couple awareness and attention to detail because these two skills really get heightened at this point. And they get heightened in several ways. If you've taken the other pregnancy academy course 24 to 36 weeks, you know that there's a split that happens at 24 weeks. You start to prepare for the birth, you start to prepare for your baby arriving, and you continue the pregnancy. 36 weeks to birth is the same thing, except those roads begin to start to converge, and then they'll separate after the birth, because the woman is still pregnant until the baby is born. That's important for you to know. She's just going through the dynamics, this transformation, this gateway from pregnancy to having a baby. So between 36 weeks and the birth, awareness and attention to detail begin to split. Your attention to detail of the baby's room, the things the baby needs, what kind of help are you going to get, what's going to happen with work, what are you going to do about finances, all those things, attention to detail. And your awareness of it is like that big because it's going to happen very, very soon. However, there's an awareness and attention to detail around the pregnancy as well. You can feel the baby move more. You're more aware of it. Somewhere between 36 weeks and, depending on how close to the due date the birth actually occurs, the belly stops growing and starts to go down. So the woman's breathing gets relieved. Her tummy gets some relief because the baby starts to settle in to the pelvis. Whether you're going to have an elective cesarean or not, depending on when the elective cesarean is going to be done, the baby's going to still make these changes. So the baby gets ready for birth by quieting down and moving down, comes into the pelvis. If you've been able to feel your baby, attention to detail and awareness, the head is above the pubic bone, and as the baby settles into the pelvis, you can't feel the baby's head there as much. Then you can begin to feel the shoulder. And if you've done any of the internal work, or if you're still having sexual intimacy with your partner, you can begin to feel the curve of the baby's head up inside her vagina that tells you the baby's in the pelvis. So that's awareness and attention to detail. The woman's breasts begin to change. Her parts down there begin to change. They get puffier and puffier and puffier because the birth hormones, relaxin, become increasingly more active. And relaxin's an amazing hormone because if you put a vat of it and then you put the thigh bone of a cow into relaxin for 24 hours, you can then twist that bone. It softens the tissue so much. So you become attention to detail about the changes in the woman's body. Is she beginning to have a discharge? If she goes into birth at this period of time, does her water bag break? Does it leak? Does it have an odor? It will have some odor, but does it smell putrid to you? Is there a color? Is it clear? Or does it white flecks, which are normal? Or is it yellow or green, which would not be normal, in which case you would get in touch with your midwife or obstetrician. If she begins to have a bloody show, there's blood and mucus. But is she drip bleeding? That wouldn't be good. You'd want her to get care. Or is she bleeding more aggressively? That wouldn't be good. You need to get care. So you're paying attention to detail to how your baby's changing. You're paying attention to detail how this woman's body's changing as it's beginning to move towards birth. And you're paying attention to detail about what you need for this baby after the birth. So you can see awareness is your ability to be aware of this, and paying attention to detail is knowing more about it and knowing what's okay and what's not okay, when to get help and when to just keep following along, paying attention to detail and being aware.